Logo, University of Birmingham. Professor Alice Roberts smiles.
I'm Alice Roberts, Professor of Public Engagement in Science at the University of Birmingham, and I'm proud to present just some of the global health research that's being carried out by our researchers here at the university, working with partners in different settings throughout the world. Now, these are just a few examples of the way that our researchers are helping to create new insights and provide evidence which will help us to tackle some of the huge challenges facing us this century. They do that by working with communities and key stakeholders to make sure that their research is impactful, locally relevant, and sustainable into the future.
Two young boys jog beside a low stone wall, children kick a ball back and forth, a child drinks from an outdoor water fountain, young teens gather on a sidewalk, and a group of adults chat at indoor tables.
Across the world, inequalities in health are a major and growing problem. Global health research helps to narrow these inequalities, providing locally relevant evidence to give the world's most vulnerable people a chance to access better health information and healthcare.
Birds soar over the University of Birmingham campus. Then we hover over dwellings in city and rural communities, and the world map appears with yellow dots in North, Central, and South America, Africa, Europe, the Middle East, and Asia.
University of Birmingham researchers are helping to tackle health challenges in many low and middle income countries around the world. Our researchers are working in all major continents, collaborating with local researchers and communities. Our research covers a wide range of health-related issues.
Text, atrial fibrillation, vaccines, childhood diarrhea, surgery, maternal health, COVID-19, Ebola, COPD, injuries, leprosy, palliative care, multimorbidity, violence, diabetes, disability, cancer, Zika, antimicrobial resistance.
We also work on the wider determinants of health. Our focus is on developing and evaluating locally relevant and affordable solutions.
Dr. Semira Manaseki-Holland, Chief Investigator of the Marsawara Project.
Diarrhea and malnutrition are responsible for millions of deaths in children globally, and Africa has the highest rates. Our research team is working in the Gambia and Mali to test community interventions aimed at reducing the burden of diarrhea and improving young children's growth.
Women and children carry a banner that reads, Weaning Food Hygiene Project, the Gambia. Then the screen splits, displaying Dr. Manaseki-Holland on the left and footage of mothers attending a meeting in an open-air tent on the right. Text, reducing diarrhea among young children through hygienic feeding practices in the Gambia and Mali.
We are working with mothers to improve hygiene during food preparation for their infants and improve its nutritional content. Many mothers know what to do, but knowledge is not enough. We use community support and motivational traditional drama and songs to change behavior.
In footage, women smile while singing and dancing. Then in photos, parents pose with their children and information sheets from their meeting. Others participate in song and dance.
Our work is multidisciplinary, working with mothers, fathers, African drummers and artists, communities, NGOs, governments, and United Nations. In the Gambia, where our intervention reduced diarrhea by over 50%, the Ministry of Health is now seeking funding to scale our work throughout the country. And in Mali, that is affected by conflict, we are studying how the intervention can be replicated in 120 urban and rural communities.
Clouds drift above the University of Birmingham campus.
Researchers from across all 5 of our colleges are using their methodological and thematic expertise to find innovative solutions to global health issues.
Text, Nick Lohman, Professor of Microbial Genomics and Bioinformatics.
In 2016, the world urgently needed to understand the origins of Zika virus, which was then associated with cases of newborn microcephaly in the Americas. To do this, we worked with Brazilian colleagues to develop an entirely new method of sequencing virus genomes rapidly.
The screen splits, displaying Professor Lohman on the left and genomic lab tests with a microscope and other lab equipment on the right. Text, images courtesy of Ricardo Funeri. Sequencing Zika virus genomes in Brazil to understand spread.
We showed that Zika had been circulating in Brazil for a full year before it was detected, and demonstrated how it had spread across the Pacific from Asia. We continue to work closely with our Brazilian colleagues using our methods to understand new and emerging mosquito-transmitted viruses.
Outdoors, a researcher examines a sample in a test tube and a funnel spout rests on the circular net's rim. Then in a series of photos, teams pose in research facilities, on an outdoor walkway, and in meeting rooms.
Our sequencing method ultimately became famous globally as it set the standard for how SARS-CoV-2 was sequenced during the COVID-19 pandemic.
Researchers from our different study disciplines work together to complement each other's strengths, producing research which is informed from a range of perspectives.
Text: Francis Pope, Professor of Atmospheric Science. The screen splits, displaying Professor Pope on the left and teams posing beneath signs that reads, Lung Institute, and, Welcome to Institute of Nuclear Science and Technology, on the right. Text: Tackling air pollution in Africa using a systems approach.
The Systems Approach to Air Pollution in East Africa, or ASAP East Africa project, brought together leading UK and East African researchers in air pollution, urban planning, economic geography, public health, social sciences and the development studies. The project provides a framework for improved air quality management in East African cities and was funded by the UK government via the FCDO.
A map of Ethiopia, Somalia, Kenya, Uganda, and Tanzania displays. In footage, people walk or ride down city streets in vehicles.
The primary study cities were the capitals of Kenya, Ethiopia and Uganda, namely Nairobi, Addis Ababa and Kampala. The success of the project has seen the replication of the approach in other cities and countries around the world, including India and North Macedonia.
A team smiles and poses in front of a window. Elsewhere, groups attend presentations in classrooms.
Throughout our research, we commit to working in partnership with the communities who benefit from the research to ensure that it's relevant and sustainable and inclusive of all segments of society.
Text: Dr. Onado Ilazumba, Qualitative Research Fellow.
Communities are central to achieving our goal of improving the lives of people affected by leprosy and Buruli ulcer.
The screen splits, displaying Dr. Ilazumba on the left and photos of a research team, people holding flowers, and a presentation audience on the right. Text: Improving self-care for people with leprosy and Buruli ulcers in India and Nepal.
This includes working with partner NGOs, their staff, some of whom have lived experiences of these conditions, as well as individuals directly affected by the conditions we work on.
Jayashri Kunju, grant co-applicant and steering board member.
I'm proud to be one of those individuals. My lived experience of leprosy has allowed me to provide crucial insights as a co-applicant on the grant and also as a steering board member.
In meeting rooms, attendees stand or sit in front of a banner that reads, South India Sub-Hub, Christian Medical College and Hospital, Vellore. Elsewhere, meeting attendees pose together outdoors.
Our researchers work with their local partners to engage with relevant stakeholders at national and international level throughout their projects to ensure that the evidence from their research informs policy and practice to make sure that that research makes a difference.
Text: Justine Davies, Professor of Global Health. In footage, ambulance lights flash at night and a dispatcher monitors data on a computer screen.
We received funding from the US National Institute of Health and the UK National Institute of Healthcare Research to work with the ambulance services in Rwanda to develop a more efficient communication system.
Text: Jean Nyanawakusi, Pre-Hospital Team Leader, Service d'Aide Médicale Urgente, SAMU, Rwanda. The screen splits, displaying Jean on the left and a team with laptops, a parked ambulance, and groups attending presentations on the right. Text: Designing better ambulance communication systems in Rwanda.
Yes, the communications between ambulance dispatch and the facility was made by multiple phone calls and delayed getting patient to the right facility at the right time.
So working with academics from different disciplines, service providers and software developers, we're building two interlinked communication systems. The first dispatches ambulances and locates the patient. The second matches the patient to the right facility.
Ambulance lights flash, a dispatcher wears a headset while monitoring a computer screen, and teams in different locations give presentations in conference rooms.
The first is already being used in our central dispatch system in Kigali. The second is being developed. Working together with the partners from multiple backgrounds and countries will mean that the system really will fits to our needs.
By supporting local academic and partner institutions, we build research capacity which can be sustained in the future and contribute to improving the health and lives of local people in the long term.
Text, Dion Morton, Professor of Surgery. The screen splits, displaying Professor Morton on the left and photos of presentation attendees and surgical teams on the right. Text, Implementing affordable, safe surgical practices worldwide.
I'm delighted to talk to you in my capacity as the co-director of the NIHR Global Health Research Unit in Surgery, based here at the University of Birmingham. We coordinate the largest research network in the world of over 30,000 surgeons in 120 countries. Our vision is to transform the lives of surgical patients through the implementation of best practice and delivering high-quality research evidence to improve the lives of our patients.
A grid displays 90 participants' photos.
Engage with us on our journey so that together we can continue to tackle the world's most significant global health challenges.
The Marsawara project is funded by the Medical Research Council, MRC, UK Research and Innovation, UKRI, Global Challenges Research Fund, GCRF. The views expressed are those of the author and not necessarily those of the MRC or the Department of Health and Social Care. The Zika in Brazil Real-Time Analysis, ZIBRA, project, zebraproject.org, is supported by the Medical Research Council, Wellcome Trust and Newton Fund, Zika Rapid Response Initiative, grant number ZK, 16078. ARTIC is funded by the Wellcome Trust, Collaborators Award 206298, Z17/2. The A-Systems Approach to Air Pollution, East Africa, ASAP East Africa, project was funded by UK International Development. The project Transforming the Treatment and Prevention of Leprosy and Buruli Ulcers in LMIC was funded by the National Institute for Health Research, NIHR, 200132, using UK aid from the UK government to support global health research. The views expressed are those of the authors and not necessarily those of the NIHR or the Department of Health and Social Care. The Rwanda 912, use of an innovative electronic communications platform to improve pre-hospital transport of injured people in Rwanda project is funded by the NIHR Research and Innovation for Global Health Transformation, RIGHT, program, NIHR 203062. The views expressed are those of the authors and not necessarily those of the NIHR or the Department of Health and Social Care. The NIHR Global Health Research Unit on Global Surgery, establishing a sustainable network of surgical research is funded by an NIHR Global Health Research Unit grant, NIHR 133364. The views expressed are those of the authors and not necessarily those of the NIHR or the Department of Health and Social Care. Logos, UKRI, UK Research and Innovation, UK Aid, Wellcome, Newton Fund, funded by NIHR, National Institute for Health and Care Research. University of Birmingham, we explore, we activate, birmingham.ac.uk. Copyright University of Birmingham 2024, produced by Creative Media 25590.